Hi, this is Dr. Singer Reddy from Empower Psychiatry and Sleep. When it comes to treating depression, there are several strategies: talk therapy, medications, and before you even seek professional help, there are other things that could likely be done by an individual by himself, such as exercise, seeking social support, more interactions with family, friends, dietary changes, certain supplements, and so forth. However, there is a set of population, almost a third of those who struggle with clinical depression, where depression does not improve despite going through medications, talk therapy, and so forth. When it comes to treating depression with medications, if one medication does not improve depression, then we think about switching to another medication in a different class. However, if that particular person does not respond to another single medication from a second class, then we think about combining antidepressants. When you think about combining antidepressants for treatment of depression, the data in terms of combinations is still limited. However, there is one medication that seems to have a relatively better data in terms of combination treatments being helpful for treating depression. And that medication is mirtazapine. When you add mirtazapine to either a drug from SSRIs or SNRIs, the response rate seems to be better, and the data with this combination is relatively much better than what we see with other kind of antidepressant combinations. Again, this drug is mirtazapine. When you combine with a medication from the class SSRI or medications like Prozac, Zoloft, Paxil, Lexapro, or adding it to a medication from the class SNRI, or medications like venlafaxine, desvenlafaxine, and duloxetine. This combination seems to have better data in terms of improvements in depression compared to the studies where the combination involved another antidepressant. Thank you very much. This is Dr. Singer Reddy from Empower Psychiatry and Sleep.